Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and on behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session on staying connected and managing stress during COVID-19. I would like to first take a minute to thank our planning team. First, my colleagues of the Patient Education and Engagement Program, the Patient Learning and Experience Centers, our Patient Partners Program, and our Education, Technology, and Media Services Program. Now, a few words about our online format. This session is being recorded and will be available for viewing with closed captioning at the same YouTube link afterwards. Today we'll have a presentation for approximately 35 minutes, followed by a question and answer period. To submit your questions, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation, but there are a few things we'd like you to please keep in mind before you submit your questions. First, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are just for general information only. Here to diagnose or provide treatment recommendations. We will try our best to answer as many questions as we can during the question and answer period. Finally, you can also vote for your favorite questions by clicking the thumbs up button, and this will help bring our questions closer to the top and they'll more likely be answered. If you have any questions about the live stream during this session, you can email us at pfep@uhn.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. And just a quick note on the topic of technology, we realize anything can happen when it comes to internet connections. So with that said, should my connection cut out at any point, have no fear, you'll be seeing one of my amazing colleagues step in to facilitate the session. And lastly, we would love to hear your feedback about this presentation. Your feedback will help us know what you found helpful, how we can improve our sessions moving forward, and what topics you would like to see in the future. So please go to the link on your screen and complete the survey at the end of the session. Or you can scan the code using your smartphone's camera or QR code reader app, and it will take you to the survey. Now, moving on to our presenters. So first we have Emily Pinkard, who is a member of our Patient Partner Program at UHN, a role she adopted following her diagnosis and treatment of a rare lung disease at Toronto General Hospital. Having worked as a Bay Street litigator prior to her diagnosis, Emily is a natural patient advocate. She holds 3 university degrees, including a master's in law. In addition to her volunteer work at UHN, Emily is a director at the Pulmonary Hypertension Association of Canada and sits on the board of directors at Paws of the North Dog Rescue. Next, you will hear from Dr. Susan Abbey, who is the psychiatrist in chief at the University Health Network Center for Mental Health at the University of Toronto. Her research and clinical interests are related to the psychiatric care of patients with medical and surgical conditions. She has worked with transplant, cardiac, and intensive care unit patients who have depression and anxiety. She has taught and researched mindfulness-based stress reduction interventions and has more recently trained in mindfulness-based cognitive therapy to prevent depressive relapse. So we have a really great group of speakers today. And first, I'll turn it over to Emily, who will be starting us off.
Okay, great. Hi, Melissa, can everybody hear me? I hope so. So first, I just wanted to say thank you to Melissa and Dr. Abbey for inviting me to speak today. And then I'm just going to dive right into it here. So in 2017, I was diagnosed with a life-threatening lung disease, as Melissa mentioned. And when I first got sick, I was working as a commercial litigation lawyer here in Toronto. I've always been ambitious and outgoing. I was a varsity athlete throughout university. So being diagnosed with a debilitating lung disease was really life-changing for me. Now, after my diagnosis, I had open lung surgery at Toronto General. I spent time in a medically induced coma. I suffered a number of strokes, and then I underwent several more lung procedures. So in 2018 alone, I had 184 medical appointments and 4 hospital admissions. So as a result of all that, I was diagnosed with post-traumatic stress disorder, major depressive disorder, and anxiety. And I tell you this only so that you can appreciate that if I can get through this pandemic with 3 clinically diagnosed mental illnesses, then there's certainly hope that that you can do it too. So moving on, how COVID has impacted my wellness. When the pandemic first arrived, I was in the most difficult years of my life. I was in the throes of it, and I used to only have to worry about, for instance, my PTSD triggers when I was going to the hospital, because that's where a lot of my trauma occurred. And then in March and April, all of a sudden they were in my face. They were on the news, and they were on the radio and in newspapers, and things like ventilators and ICUs were being mentioned. And so that all triggered a lot of horrific memories for me, which sort of brought back the PTSD. And because I already have a potentially life-threatening lung disease, the threat of catching COVID was then and still is terrifying. And that just really worsened my pre-existing anxiety disorder. So the pandemic for me couldn't have come at a worse time. And lastly, as someone who is naturally social and who I typically really like to keep busy, I've found that these 8 months have been really isolating and lonely, which I think also sort of exacerbated my depression and the symptoms with that. So so it was a lot, and the early days were really tough, and eventually I decided to just make a conscious effort and deliberately take care of my mental health. And now the good days really do outweigh the bad. So I think that those strategies that I've sort of been tinkering with have helped. And so I've chosen to share a few of them with you today. So the first one, this one's super important, and I find that it's also really easy. All you have to do, for this coping strategy, it doesn't require any proactive work on your part, but you just turn off the news, or at the very least limit it. You're probably not aware of how much the news is affecting your stress, but it is. And I assure you, you're not missing anything. There's nothing good going on in the news in 2020. So just skip it if you can, or if you do have to check it every now and then, just try and use really reliable, credible sources. The second thing, and I think that this is particularly helpful for those of us who are not working or who are retired, is to try and find a new daily routine. A lot of the things that kept us busy and that we enjoyed, like social functions or hobbies, fitness activities, they've all been canceled. And so I do think it's important to try and maintain some form of a schedule. It's worked for me, and it doesn't necessarily need to be a daily routine. It could be something as simple as every Tuesday at noon, I walk with my friend so-and-so for 1 hour, or every Sunday night, I call my grandparents. But knowing that you have somebody or something to look forward to and somebody to account to, I think it really helps. So that's the second one. The third one is altruism. And I have found, even before the pandemic, ever since I was first diagnosed with all of these mental illnesses, I found that helping others to relieve their own stress can sometimes help me with mine. And I'm told that there is, a connection between altruism and mood. And it doesn't necessarily mean you should go volunteer at a soup kitchen or start cutting checks to not-for-profits. It could be something like donating your used clothes to a charity. For me, I fostered 2 puppies from a dog rescue organization this summer, which was a lot of work. But it doesn't necessarily need to be that huge of a time commitment. It could just be, giving up your seat to somebody on the, an elderly person or a pregnant woman on the TTC. It's just a matter of like helping the people around you. And I think that for some reason it just works. Maybe Dr. Abby can comment on that. And then humor, of course, is also really helpful with like in these times. Humor can give us a break from whatever's worrying us. So if you're picking a book or a TV show, a movie or a podcast, I find it helps to pick something that's really lighthearted and stay away from the genres that might make you feel even more worried or more stressed, like true crime or medical dramas. Just like stick to the lighthearted stuff. And then second last is to keep in touch. And I think that this is one of like probably the most important one and the one that everybody is struggling with the most. And that is to just make a point of staying in touch with your friends and family. We are missing so much social interaction right now. And it's not just Christmas parties or play dates or after work drinks. It's a lot of you are also missing your morning banter with, your coffee barista or your water cooler chat with your colleagues. And I think that all adds up to a very real void. And so it helps to try and make a deliberate effort to work on that. And CAMH has a really good slogan that they've been using during COVID, and that is apart, not alone. And I really love this. I think that we all do need to realize that just because we aren't physically in a room with our loved ones, it doesn't mean that we have to be alone. There are obviously a lot of resources, out there, but also there are many ways that we can connect with the people in our lives, whether it be by phone or video call. Last week I saw some more elderly gentlemen sitting in a parking lot outside of Tim Hortons in lawn chairs, 6 feet apart, just having their morning coffee. So there's ways to still catch up with your friends or your family, on a regular basis. And I think that's really useful if you can. And the last one here is to take time when you need it. I want these are really tough times for everybody. You don't have to have any pre-existing mental illness. These are really hard times. And if you aren't feeling great, it's okay to take a day for yourself. It's okay to take a mental health day or a vacation day or a personal day and literally just do nothing if you want to. Don't feel like just because you have a day off, you have to be doing something productive. Every now and then, it's all right to just take some time. And if you want to hang out in your pajamas and watch Netflix, like that's okay. Everybody's struggling and you may just need time for yourself, and that's fair. So there are, so many different strategies. I've only named a few. Getting outside, exercising, reducing your screen time, drinking less alcohol, less caffeine. There's this endless list. Dr. Abby's going to touch on a few of them. There's a million online resources. But I would say that the most important thing is to keep in mind that you can't do them all at once, and nobody can. If you try too many coping strategies at once, you may actually feel burdened by the task of having to do them all. So, which would be counterproductive. So my advice is to try different strategies at different times and, see which ones work well for you. So I really hope that you are able to take something useful and positive away from this. I know you'll get definitely a lot of great tips from Dr. Abby. And I really want to thank you for listening to me today. Helping others really gives me a purpose and it keeps me busy. So by tuning in, you've already helped one person today, and I appreciate that. So thank you very much. And I'm also looking forward to hearing what Dr. Abby has to say.
Thank you so much, Emily, for sharing your story and your experiencing navigating these definitely like unprecedented times. And I think you're right, there's so many tips and you've provided some really helpful ones for us to try. So thank you. So now we'll move on to the rest of the presentation. And next we have Dr. Susan Abbey, who will tell us a bit more about the impact COVID-19 has had on mental health and relationships. She'll also share some strategies to help you stay connected with others while you're self-isolating or staying at home, some strategies to help you maintain healthy relationships and to manage stress and anxiety during these times. And she'll also share some resources at UHN and in the community that can help you manage your mental health. So now over to you, Dr. Abbey. Oh, I think you're on mute, Dr. Abbey.
Oh, I thought you guys were controlling it to keep me quiet. So thanks so much, Melissa and the whole team. And that was a fabulous job, Emily. I feel like I can just go home now because you've really lived it, and it's really hard. So we're going to talk about all the things that Melissa mentioned. If we can move to the next slide, I made a list that's sort of depressing, but I think it's important for us because I think each of us in our own little bubble can feel like there's something wrong with me for not feeling great, or, for me for having a down day, or me for worrying about things. And I think what's really clear is that COVID-19 has caused many mental health challenges for many people. It's reactivated problems and I was very touched hearing you, Emily, talk about how, before it was okay because the PTSD triggers were kind of in the hospital, so you could live a whole bunch of your life apart from them. But then with the with the advent of all of the coverage of COVID, suddenly there are ventilators everywhere, and you're having this sort of stuff assault you just out of the blue. So I think that's been a common thing that people have described. I think for people that have had no issues in their life before, and I sort of have a little subspecialty this last few months in doctors who have had no troubles in the past and now are developing for the first time depressive illnesses, anxiety illnesses, and all of those are very challenging. I think it's really hard for us around dealing with the uncertainty. And one of the things that has me very excited, as I said, I went home last Thursday night and I felt so tired and so down. But Anthony Fauci was on my TV talking about, when they were going to start rolling out the vaccine in the US. So I know, maybe a little different in Canada, but now for me, at least, I've got this sort of idea in my head. I haven't picked, for me, I'm going to pick a date, but like what date I'm kind of hoping that things are going to be okay by. I had a colleague this morning text me and was saying, she just so wished I could come visit. And I said, well, I think we can in September 2021. In one way, that feels like, oh my God, September 2021, that's like forever. And yet it really is not much longer than we've already been doing this. And there's an end in sight. I think of really old movies. I remember my grandma watching as a kid, and sometimes the prisoners would have like calendars and they'd be Xing off the dates. And so thinking almost about like that we can start to do that now that we know that things are going to get better from this. I think lots about relationship stressors. And then I think also, changing so much about how we work, how we hobby, how we craft, how we parent, or co-parent or grandparents. So all of those have caused many mental health challenges. And I think it's really important for us to take care of our mental health. Melissa and I went back and forth on where best to put some of the resources. So we're going to put most of the mental health resources, we're going to go through those in some greater detail in the latter part of the presentation. So we will do that. And then I think the other part around mental health is trying to see if we can kind of consciously bring up our resilience. So if we go to the next slide, Melissa, we're going to come back to this as we go through, but there's lots of good scientific, psychological, biomedical evidence that we can cultivate the capacity to be resilient, that we can make small choices in our day-to-day life that help us to be more resilient. And when we do that, that really helps us with our mental health overall. So I always remember them because it's the 5 C's, and we're going to really focus mostly today on connection, but we'll talk about some of the others a little bit as well. So if you go to the next one, Then I think about staying connected, and we go to the next one. I think we have to remember that connection is just central to being human. And we differ, we could line us all up in those days when we could line up. Now we all have to have 6 feet between us, but we could line us all up. And there are people that need lots of connection. And there's some of us that need, little doses of connection. But at the end of the day, we all need connection. And so I think it's really important to remember that's just part of being human. And that despite COVID, we can have connection. That what we're being asked to do is to, physically distance, not to socially distance. And we have to keep our connection. The other thing that is sort of very hard, I think, for me, for my patients, for my colleagues, is how much COVID almost drives us into an us versus them mentality. I feel sort of safe and healthy in myself today, but everybody around me could be bringing me the virus, or could be a cause of fear. And trying to really consciously, in my own mind, reconnect with really, we're all in this together. Everybody's suffering. And in some ways, we're lucky because, or I'm lucky because I'm suffering, in less ways than some other people are. And trying to let ourselves remember that, I think, can be important, that we are interconnected, that we're all trying to work with this and trying to be kind and helpful to each other. I really liked Emily's points about the altruism, because I think that's super helpful. But go to the next slide. I think I've got, it's very interesting. We always hear about fight and flight stress reaction. And some people would say that's because a whole lot of stress research was done by men. But that more recently, there's been this whole body of work that also says that under stress, the other mechanism that can be invoked is tend and befriend. So, taking care of people, taking care of myself, taking care of people, taking care of animals, taking care of plants, taking care of the world, and seeing our common humanity, our connection, that in specifically doing that, just that it actually takes down the stress and lowers our distress. And so that's a really helpful thing to think about, and to think about ways in which in daily life, maybe you could choose a tend and befriend response to help with the stress. As I said, we have to remember it's physical distancing we're supposed to do, not social distancing. And I'm going to show a slide in a minute about some of the technologies, but thinking about how we can use technology to foster our connections. So, I think we have the current relationships in our life. One of my dear friends who she lived alone she'll say to everybody, who lived alone for the first 142 days of COVID because her husband was stuck in the States. She said she established a group of people that she checked in on who were living alone. One of my work colleagues, who has a very busy life, but feels like it's hard to talk about some of the stuff that's more makes you feel more vulnerable. She's established her list of COVID buddies, so that that there are like a couple of people that have just agreed to check in on each other, to see how each other are doing. I find humor, which Emily mentioned, that is so helpful to keeping my soul, stable and feeling like I've got some energy in my gas tank. So I have a thing where I collect memes. And I send them around, and it's funny, and I kind of almost have a curated set, and I know who's going to find what appealing, and so I send out memes every day to sort of a circle of friends. I think the other thing that a number of people have done, and I don't know whether anybody who's listening to this call has done, but I know some people who have really consciously sought out to reconnect with past friends. That if we sort of think about our kind of there's actually an exercise in one of the psychotherapies for depression where you draw like larger and larger circles coming out. So, you've got kind of your inner circle, and then you put people on them, like how close they feel to you. And, often we think about that sort of inner circle, and if we're confined with them, or if if we're living alone and they're the only people we're thinking about reaching out to, it can feel like we're burdening them, or it's hard. If we start to think about like who else in the kind of circles farther and farther out from us, who are some of those people that maybe were really dear to me like 20 years ago that I haven't connected with, and write to them. So one of my good friends who's a psychologist, she's taken up once a week, she writes a letter to somebody from her past. She's had a lot of fun with that and has reconnected with people, and now has other people that she lives alone, and she sort of now has snail mail to come home to, and she has emails in her inbox, and she's found that really helpful. So if we go to the next slide, I put a whole list of ways of thinking about technology and connection. So, the telephone, I think there are a lot of internet-based options. If you can't figure out, and I'm not very good at figuring out like how to make stuff work on this, so getting a younger colleague or friend or family member to help can be very useful. I used to think texts were stupid. I love texting now. Email, snail mail. People really like to get a card or like to get something in the mail. I just got something from a cousin that I haven't heard from in 20 years, and she was talking about how she's felt with COVID, like a desire to reconnect with people, and so she's been doing that. Thinking potentially about going out for walks or coffee. Again, another friend talks about she has people she has six foot walks with, or 6 foot coffee with, and people she has 12-foot coffees with. But thinking about that. I know people who have started things like book or TV show or movie clubs online. So they just get a couple of their friends, and then everybody watches the same thing or reads the same thing, and they just get on a free Zoom account for an hour and do that. The other thing is, a lot of the time that we spend with other people, we in sort of daily life, apart from COVID, we're not constantly intensely relating. Like we're living our life and they're living their life, and so the potential of like just keeping the phone on for an hour or two, and like talk while you're doing dishes, or Zoom while you're doing things, or for people that have grandchildren or younger nieces and nephews, you can just put on the Zoom, and then what happens sort of in real life is that if you were actually in the living room with them, they would be with you for 5 minutes, but then they'd wander away, and then they'd come back, and then they'd wander away. So kind of letting people do that, and sort of trying to do things that you'd said that you'd never do before, because these are strange times. We can go to the next one, and that's if you live alone, I think it's particularly hard. So again, I come back to this: be kind. I think everybody's struggling with this, and so if you can give somebody a smile, or you can say something nice, or you can connect with them in some way, it buoys them, and it actually buoys your own emotion. And again, for people that are more tend to be more on the introverted side, it can feel hard to make that first comment. But I think the whole world is looking for connection, so I think this is a great time to be trying. And then potentially also reaching out to people who you also know live alone, and along that idea of the COVID buddy, or somebody that you're going to check in with every day just to see how things are going. And having a list of folks that you feel some sense of friendliness or or connection to, so that you might connect to some of those from that you haven't had contact with. We go to the next one. It's really around the healthy relationships. And then if we move to the next slide, I think the big challenge is that everybody's struggling, but we're all struggling in different ways. And so if we can really come with that sense of kindness, and Melissa found this image for me. I love this saying from the Dalai Lama. He says, "Be kind whenever possible," and then he reminds us it is always possible. So, and again, that kindness is so important, because at a central nervous system brain level, it modulates the firing of various regions in the brain that help to settle and calm us and make us feel better and improve our mood. I think we have to really ask ourselves kind of, what do I need? And then be able to tell people, right? And we need to be able to ask the people in our lives, what do you need? So, and particularly people that are in small really small spaces. If it was my friend who I told you about, who was talking about her 145 days of being alone during COVID, now she'll laugh at times and say, "Oh," and I would go, I'd give anything to be back to the 145 days alone, because now she's in, her apartment with her husband, and he's driving her crazy. So sometimes it's reminding ourselves the grass always looks greener with somebody else's circumstance. So, what's good about mine? What can I enjoy about mine? And then what do I need? And, most of us need some time on our own. And so whether that's, going out for a walk, or having sort of some part of the day where there's some agreement that we can just be quiet, or that, but figuring out what do I need and what do they need. And then if we can go to the next one, a couple of thoughts about whether we're jammed up there or not. A couple of thoughts about some of the other 5 C's of resilience. So let's see if we can advance those. And there's one more and one more. So if we come to the C of commitment, that's really, so if we have a sense that we are dedicated to something, and that again sort of speaks to what Emily was talking about with the altruism and fostering the rescue dogs over the summer, that if we've got some dedication to something, it could be anything, but something that is outside of ourselves. So again, it could be helping other people, it could be art, it could be beauty, it could be nature, it could be animals, it could be people, it could be anything. If we have some sense of commitment, that really helps. And so I think it can be useful for us to think about specifically, like, what am I committed to? How can I live out these commitments during the time of COVID? When we come out of COVID, and I think we have to just remind ourselves every day, this is not our life forever. This is a discrete time. But what are we going to take away from this time? I was really touched in the spring one day. I was home on a weekend and watching CNN and getting myself upset, but then Andrew Cuomo came on and was giving his update about New York, and he put up a slide. He was talking about how his daughters were saying that they were finding COVID going on so long, and he put up a slide that showed how long things had gone on, like the Great Depression and the Second World War and the Korean War, and it really made me think about my mother and how she talked about World War II and how hard it was to have this feeling that things, were never going to end, and not being sure about how it was going to end. I think this time we're lucky because we know that there's going to be an effective vaccine and that we are going to come out of COVID. We don't know that whether we're going to be out of it, by July or September or January 2022, but we know we're going to come out of it. And kind of what lessons or what commitments are we going to come out of it with? And are there things that are going to be meaningful for each of us individually in our lives moving forward? And then are there new commitments that we might want to make, or current commitments that we might want to modify based on COVID? So thinking about commitment is something that can be something that's really helpful for people around combating stress. To go to the next of the C's, it's caring. And so caring for ourselves and others is really super important. And I think for probably most of the people who are watching this, probably anybody who grew up before the 2000s, caring for yourself was not a good thing. That was not something that your family would have talked much about. You would not have been encouraged to do that. And yet we really understand now so much about how self-care, compassion for ourselves, taking good care of our body and our mind is really important, and that it's the foundation for everything else that we do. And so really working on that. And, I think this is an opportunity for us to tune up self-care. And so I've put a list of sort of some of the common things, like I think really optimizing our sleep, exercise, nutrition, finding small pleasures in daily life, laughing, being kind, cultivating optimism. One of my favorite patients says to me that, she says, the only thing I know is true at the end of the day is that we are one day closer to the vaccine. And so I've adopted that. At the start of COVID, as I was asked to sort of pull things together for some of the hospital community around this and was reading about this, I kind of looked at the list for myself. In some ways, exercise and nutrition might on the surface seem better choices for me, but I decided that during COVID, the biggest thing that I was going to do was optimize my sleep, because sleep is so central to everything else. So I have defended my sleep against all else. But, take a look at the list and pick something for you. And then if we go to the next one, I love this. It's a quote from Sam Burns. He's got a great TED talk about his challenges with a rare genetic disorder. He said, "It's not that I ignore when I'm feeling badly. I accept it. I let it in so I can acknowledge it, and I do what I need to move past it." And I think that's really wise words for us, so that and then we'll talk a little bit more about moving past it. So if we go to the next one, is calming. And I think there are a whole lot of different approaches to calming, and we just need to find one that works for us, or maybe a couple that work for us under different circumstances. And we'll show you some more resources in a minute, but it's really about kind of allowing those feelings, because once, if you can feel, there's an old expression in psychology, if you can feel it, you can heal it. That where we get in trouble is when we have emotions and we try to push them away, or we deny them, because then they just come right back at us. So if we just can feel them and start to work with them, that's helpful. We can ask for help, ways of kind of burning off excess energy. Always returning to the breath is always a source of comfort and support for many people. And then some calming skills and calming down, and we'll show you some resources in just a moment. But just before I end, I thought it'd be remiss if we turn to the next couple of slides. I thought we'd better talk about what a COVID-19 Christmas, Hanukkah, Kwanzaa, New Year's Eve looks like. So if you go to the next one, this is kind of a happy image, or not, but of somebody kind of in their little bubble. But I just got, when I was telling you about my memes, this is the meme I got just on Tuesday and got Melissa to put in. If you go to the next one, and in some ways it's corny, but in some ways it's lovely. Maybe this is not the Christmas to ask for anything we want, Linus. Maybe this is the Christmas we just need to be thankful for all we have. And it was very interesting. I had a discussion about that in the coffee lineup at Starbucks with one of the ICU nurses. And, we were really talking about, we can list all the things that we don't like about Christmas and that we can't have, but there are so many that we do have, that we're so blessed with. So if we go to the next slide, another quote that I saw this week: "You can use this special time of the year to practice extra self-care and give yourself extra love." But I think one of our big challenges is, what is it that means? And so what can I do for myself? And, just maybe getting out a piece of paper and writing down every morning for the next, week or two, what would make me happiest? What would make me feel refreshed? Many of the things that normally, I was talking to one of our senior docs last night, who was so frustrated because everything that he would normally do to take care of himself or to give himself some more energy, he can't do because of COVID. So trying to start to think about, what it might be. And then also, what would make me feel like I celebrated? So we had a very crazy discussion at the dinner table on Sunday night I'm a single mom with sort of 2 teenage girls. And so we decided we're having a crazy Christmas. And we're just going to try to figure out, it's not going to be like any other Christmas. And I've told them I hope it's the only Christmas like this that they have. But, maybe we do something different. Maybe I'm going to just eat shortbread and drink champagne all day. I don't know. But with something that is happy and that is just for you and just this year. And as Anthony Fauci said last Thursday, we had last year and we've got next year, but we have to do something different for this year. So now just to quickly go through the resources, and if we'd pull forward, all of these will be available. So the first thing, I think if people are having real troubles, talk to a healthcare practitioner, to your nurse practitioner, to your doctor, to the healthcare team for support they have, and can refer you to specific resources that meet your needs. And it's really important to do that. And, this time of year can be really hard for people. There are also wonderful crisis lines where they're free and confidential and anonymous, and there's a human voice on the other end, and they will talk to you and they'll help you figure out things. And I think often in talking aloud to somebody, even if there's somebody who doesn't really know us well, can be really helpful to kind of sort things through and get our heads back on straight. Then if we go to the next one, the Wellness Together, the federal government has put together resources because mental health is such a huge problem right now across the country. Slide that has a whole bunch of online tools and resources and free e-counseling, and there's crisis text support. In the bottom right of that, I love it, says wellness starts here. Mental health is a journey, not a destination, right? And remembering that and being able to use some of those resources. I've got some online resources. The next one, there's this website called 10% Happier. And they've got a coronavirus sanity guide. And they've got a whole lot of practical resources and meditations and some articles on coping with stress and fear and anxiety. And they have been very helpful to a lot of people. We go to the next one. If you've got a smartphone or a tablet or a computer, there are mobile apps that have free COVID content. So Calm and Headspace are two of the most common ones, and those will be up, and you can just do the QR code thing with your camera and make it happen. Next one for us, Toronto Rehab, one of our 4 hospitals, have a great service, and they have put together these series of body scan relaxation, breathing, quick meditation practices. So having a look at those, they're a great starting off point. And then, like Emily said, don't do it all at once. Try one a day or one a week. And as you start to find what works for you, then you can also go on to Google or YouTube and put those same things in. So they have like ocean imagery on this one, or breathing space. And then if you find, oh, I really like ocean imagery, then you put into Google ocean imagery meditations, and then you'll get like 1,000 of them. You'll have more than you ever need for COVID. And then finally, I think we got 2 more maybe. Let's see what's next. Ms. Melissa, oh yeah, Together All. This is formerly something called the Big White Wall. It's all peer support. It's an anonymous community. They've got all sorts of things from texting. They've got online art tools and creative tools to express how you're feeling, and all sorts of really helpful stuff. And then the last thing we're going to show you today is Connects Ontario. And it provides free and confidential health service information for people around accessing mental health care. So that's a really good one. And then if you still can't find the resources you're looking for, next one, contact the UHN Patient and Family Libraries. And we've got an incredible group of staff there who are trained health information specialists, and they can really help you find reliable, up-to-date information about kind of what's helpful for you. So hopefully that's a whole bunch of ideas and suggestions, and I just really encourage people to just pick one thing, and whether it works or doesn't work doesn't matter. If it works, then you know it works and you've got it in your toolbox. If it doesn't work, then you've tried something, and like, let's go on to the next one. And then hopefully you get a little toolbox of things, and they help with whatever the trouble is at the moment. So back to you, Melissa.
Thank you so much, Dr. Abby. And on behalf of our participants and the patient education program, thank you, Emily and Dr. Abby, for sharing your expertise and experience around mental health during COVID-19. Personally, and I'm certain I can speak for everyone else as well, that these tips and strategies you have shared today will help us better cope and manage the mental health effects of COVID-19. So now we will check our Slido to see what questions have been submitted. And for our viewers, you can still submit questions if you haven't already. To submit the questions, just go to slido.com and enter UHN Health Talk in the event code. You can also scan the code using Take You Straight to this page. I just want to remind everyone just very quickly that you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do choose to include it. We also ask that you please do not include any personal details about your health or condition in your question. Our health talks are just for general health information only, and our speakers are not here to diagnose or provide treatment recommendations. And we'll try to answer as many questions as we can until about 1:57 p.m. today. And another quick reminder, you can also vote for your favorite questions by clicking the thumbs up button, and this will help bring the questions closer to the top. So I see here that we have quite a few questions already submitted, and I'll start with the first one here. Oh, this is just a quick reminder. So someone has asked, my 80-year-old father lives in a group home and will want to come for a Christmas visit. I'm high risk due to asthma, so we are being really careful to follow public health directives. How do I manage the worry about him being lonely or the guilt if I don't see him on what could be his last Christmas? So I think I'll turn this one over to Dr. Abby because it touches on your section about the holidays this year.
I think this is really hard, right? I'm hoping for you that his group home is going to say he can't go out. So I think hopefully keep your fingers crossed on that one, because I think most of the homes, long-term care facilities, are being like super vigilant about that. And then I think one of the challenges when people are older is there is always this worry about last this, last that. Anthony Fauci said last Thursday night, you can see I was very impressed with him. He said, there's a difference about it being the last Christmas in retrospect and you making it his last Christmas by spreading bugs. So I thought that gave me some comfort. I was sort of thinking, I've got a very elderly relative, and I think, yes, that's the goal for this Christmas, is to not kill him with COVID. So that I think that is helping me. And then I think focusing maybe instead on what you can do. And so I'm trying to pull together some family photographs, and but then I realized that the framing store is closed because of the lockdown. So I'm hoping they're going to be open on December 22nd, and I can go buy some frames. But if I can't, then I'm just going to have to take the photographs. And again, it's there's no perfect answer, but I think it's like doing what you can and knowing that you're making choices really for the long term, for you and for him, and that's hopefully brings some comfort.
Thank you so much, Dr. Abby. I think that's a great takeaway, is to remember about what we can do and try to keep that positive mindset. Thank you. Okay, so I'm going to go to the next one here. And somebody has asked, we feel like our extended family are not taking the same precautions as my family to remain safe during the pandemic, and they insist on getting together even when we're not comfortable. This adds considerable stress to my family. Do you have tips on how to navigate through this? So this is also, maybe Dr. Abby, would you like to start?
If Emily, as the lawyer, has some ideas for us too, but I was going to say, so it was very funny. My Starbucks conversation this morning was about this very question. And it was one of our members of our nursing staff who, was talking about she's got asthma and as an increased risk, her husband's at increased risk, and yet, their families are both being stupid. And she said at the end of it, I said, well, what are you going to do? And she said, well, at the end of it, I've decided you can't cure stupid. And I'm not going to fight with it. And I'm just going to do, what makes us happy. And I thought in some ways that's just so helpful. Like, I think to try to get into going back and forth with people about the risk and everything is really hard. And I think it's better to just say, sorry, can't do it this year. The other thing though, sometimes that you can do, like particularly if people are in the city. So I know some people who are doing like really sort of, in some ways, they think of it as fun. I think of it as a lot of work, but like maybe where 3 families that, siblings that would normally come together, the grandparents for Christmas, instead everybody's making a course. They're going to drop them off at everybody's house on the porch, and then everybody's going to eat their dinner together on Zoom. And that's kind of cool. So you could potentially do something different like that, or they'll do more phone calls, and again, so I think it's kind of better to say what we will do. So, well, we can't come, we're not going to come to dinner, but we'll call everybody, or we'll do this, or we'll have a video conference or something. Because I think otherwise, I think if you're trying to think that you're going to win them over to common sense and following public health, it's really hard.
Thanks, Dr. Abby. I agree. I think there may be suggesting strategies that you can do, such as doing things virtually may be a better alternative or the better alternative and a good workaround to having these really tough conversations with family members. Thank you. So we'll go over to the next question. It looks like we only have one question left. I wanted to remind everybody that you're welcome to still submit questions by going to slido.com and entering UHN Health Talk in the event code. And this person has said, I find I have to guard my previous mental health problems from family, which seems more dysfunctional than before the pandemic. Are there strategies for putting boundaries around ourselves so we feel safe? Dr. Abby, would you like to start again? And then Emily,
whether Emily's, because I think she's also been living all this, right? But I think it's, I think it really is around like that we're putting the boundaries, that we don't have to ask permission for them. We also have to realize that probably they, I think they probably are more dysfunctional than they were before the pandemic, right? Because everybody's suffering so. And so whenever, so the nurse saying this morning, you can't cure stupid. So part of me agrees with that. But then in my own head, I try to go, because I know that if I go down the stupid line, I get cynical and I get angry and it's not good for me. So I try to substitute stupid with suffering, right? Because I really think people are kind of, everybody's got all their own suffering. And the unfortunate thing is when it then increases ours or invades our space. So I think it really is around trying to put up boundaries, figuring, and in some ways COVID's great because that puts a set of limits that might not otherwise have been there. Trying to limit the amount of time that you talk with them, what you'll talk about. And one of the really interesting things in our mindfulness-based stress reduction program, we spend a session on stressful interpersonal communication. And one of the things that is just so fascinating is that if we start to change our communication, ultimately it has to change the other person. Because for most of the time, we've got these well-oiled, well-organized dances. I say white, he says black, I say white, he says black, then we have a fight about it, and then there's trouble. But if I start to do something else, they may come back with what they normally would do, but at some point it just has to shift because you're not engaging in that dysfunctional dance anymore. And I can remember actually having one of the first groups I taught was around this time of year. We were coming to the end of the group and we were having this discussion about communication, and this poor young woman was saying, well, my family are so crazy and they're so awful and I can't see it changing. And I said, well, the only thing I can say to you is just try, tell them what you need, tell them what you're doing, don't ask their permission, just put it out there. And she came back in just 2 weeks. It was only 2 weeks later. And I said to her, you're going to probably have to do this for 6 months before they shift. And 2 weeks later, she came back and she said, wow, that was like, they responded differently. And I thought, wow, that was pretty cool. Right. But if we break the pattern, people know how to do, like they know what the fight is, or they know kind of where the struggle is. And often the struggle can be energizing, or, make people feel like they're caring, or, that you really need some direction and I'm going to give it to you or whatever. And if you just kind of take it 15 degrees off, come at them with something else, it often will break the pattern. But I just really encourage you come first. You need to take care of you.
I think I would just add, and my approach to my own mental health was a little different than this person, but the other thing is to just sort of like look at it and know that the boundaries, if it's for you because it makes you feel comfortable, then that's good. But if the boundaries are there because you're worried about how other people are going to react to it, I would encourage that person to try and open themselves up to the idea that there isn't as much of a stigma on mental health issues anymore. I mean, here I am talking about my PTSD. I've given speeches about mental health to like hundreds of people, and kind of airing it out. And that's me, and that's one extreme. But I do think, even yesterday we saw Meghan Markle wrote an opinion piece where she was talking about her own struggles. So I think that we're in a place now, at least with Bell Mental Health Day, and there's more of a conversation about it. So another way to approach it for some people, maybe not for this person, is to just go to your family and say, look, I am struggling and I need help, or I need you to do this, or I need you to stay away, or I need you to just be patient with me, or I need you to reach out to me more frequently. And I think for me, I have family members, like for instance, my sister knows that something that brings me joy every day is like watching videos of my nephew, because I haven't been able to spend time with him. So almost every day she makes a video and she sends it to me, and it brings joy to my day. And, she's doing that because she knows that I'm really struggling. And so she's able to kind of like do what she can to help me. And so there's the one approach, which is sort of guarding it and going through it on your own. And the other approach is to just sort of say, like, this is the issue, and maybe fix the judgment that you're scared of, or, the criticism, and make you feel more comfortable. So I would just, encourage people to at least think about that. I find that younger people are more open to that just because it's a generational thing. But I have, siblings that have struggled with mental health, and their approaches have been different than mine. But I think that it's something to consider, and it might be helpful. So those are my thoughts.
Thanks, Emily and Dr. Abby. I think what you both said are really inspiring, in that you're right, like communicating what it is that you need and what you want can really help set those boundaries, but also help the other person realize what it is and how they can help you. And you never know, they may surprise you, like you said, Dr. Abby.
The other thing I just want to add on that is that sometimes when you suffer in silence, people they don't even know, like having an invisible illness, or which could be a mental illness, or it could be, with my lung disease, it's invisible. If someone just looks at me on the street, they're like, you look great. They don't know that I'm like struggling. And so by kind of breaking down that barrier, it allows people to treat you with the empathy or the sympathy or the listening skills that will help you to heal. So in a mental health scenario, if you communicate to your immediate circle, I'm having a tough time, then they can act. But you can't, really blame them if they don't even know what you're going through, right? So I'm definitely a big advocate for being open about mental health, but that's me.
Thanks, Emily. And I think like the fact that you're presenting, like you said before, can help encourage people to have these conversations too. So thanks so much. Okay, let's see if there are any other questions. Oh, we have someone here. Oh, let's see. Someone has asked, how can we help our healthcare practitioners because of their stresses, such as my GP had a large practice before the pandemic and always seems stressed, and I don't want him to burn out. My chiropractor is stressed with all her patients working at home with bad ergonomics. Any thoughts? So I think, let's see here. Let's take a few seconds to gather our thoughts here and see if anyone has a response to this one. So I think this may be a question about healthcare workers and how we can support them. Dr. Abby, I see we have 2 minutes left, so would you like to answer this one very quickly?
You know what? I think you could send either of them like a holiday season card saying thank you so much for all you do. I mean, it sounds like people often think that's very small, but it's huge. It's funny, I'm on a listserv for women physicians, and people will take photos of cards they get, not showing the patient's name or anything, but just so deeply touched that somebody bothered to send them a card, and they talk about keeping the cards in their drawer to pull out when they're feeling badly. So I think that's a huge thing to do. And I also say when people say, what can they do to help? I say, stay home, right? Like, I think it helps healthcare practitioners to not see people out doing all sorts of crazy things all over the place.
For sure. Thank you so much. So because we are near 2 o'clock now, unfortunately, we were not able to answer the other questions, but if you do have some more questions that you would like the presenters to answer, you have a chance to by emailing pfep@uhn.ca, and we'll respond to your question within 1 week. And I'd also like to emphasize that your feedback is really important to us, so please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you to the survey. And lastly, to find out about our next talk, please subscribe to our MailChimp e-newsletter and get up-to-date information about events and new resources at UHN. And to fill out a form to subscribe, please go to the link on your screen or scan the code. And finally, I'd like to thank you all for attending, submitting questions, and thank you again, Dr. Abby and Emily, for sharing your experience and expertise. So thank you.